Hi, I'm Rick Fox. Welcome to Talking Safety. We're joining you from the 23rd World Congress on Safety and Health, right here in Sydney, Australia. Our next guest is Dzfia Ahadzi. Dzifa is the founding president of the Health and Safety Group Africa, a non-government organisation dedicated to advancing occupational safety and health. His research interests encompass a wide range of topics, including occupational injuries and diseases, safety culture, job demands on employee health and safety, and organisational safety leadership. Dzifa, it's an absolute pleasure. Welcome.
Happy to be here.
Can you tell us a little bit about the Safety Group Africa? Where did it come from and what's the current focus of the group?
So currently our focus is on research. Even though we do a lot more in terms of advocacy and training, we do a lot of research in the area. We've done the research on safety culture in Ghana's health sector. And it will amaze you to know that the safety culture of our health workers back home is nothing to write home about, actually, you know. And so ours is to bring forth and bring out these issues, these salient issues, these very important issues to the public domain for discussion so that we can shape safety issues back home in Ghana.
Speaking of Ghana, can you tell us a little bit about the OSH landscape in Ghana?
Currently, the civil society organizations in Ghana, together with other stakeholders, have been pushing for an OSH law in Ghana. We have an OSH law. We have something like an OSH law in Ghana, but this is a very old law. Things have changed, and we expected that things to change, so we've been pushing for a new law. Good to know that now the government has agreed that there must be a new law. So currently it's at cabinet level, where we will be having a new occupational safety and health law in Ghana. But our argument with the Minister of Employment is that we want an authority. We want occupational safety and health authority in Ghana. So we're trying our best to try and shape, the safety culture better back home in Ghana.
During your field work in Ghana, you observed the working conditions of stone quarry workers affected by silica dust. Can you tell us what you saw?
It was absolutely devastating because you go to the stone quarries in Ghana and you see a lot of dust, high dust levels. This was our first observation when I led a team of researchers from HESAG Africa to do this research work. And interacting with the workers, they open up to us on so many things that we were surprised about, actually. First and foremost, we know that this is a hazardous industry, and so wearing or using protective equipment, like personal protective equipment, I should say, is very important. But to interest you to know, 5 regions out of the 8 regions in the southern part of Ghana that we visited to do this work, majority of the quarries we visited, the stone quarry workers were not using personal protective equipment. And this was exposing them to the hazards of silica dust. Absolutely. We all know what silica dust causes to the body in terms of health. Silicosis is the major disease caused by silica dust. And these guys, mostly vulnerable people, young people, doing these jobs to feed their families, this is their livelihood. They sometimes want to talk, but they hold back. Why do they hold back? Because they don't want to lose their jobs, and it's terrible. It's a terrible situation. And it was glad that HESAG Africa, my organization, we stepped in to do this research to highlight the issues that are happening in the sector. And we were glad we did it because it helps us to see the issues hands-on and what is really, really going on in the industry. Can you imagine a worker is provided with a personal protective equipment like the nose mask, and for several months it's not been replaced? You and I know that working in a dust environment, you need to consistently, periodically replace your nose mask at least. But these guys are not provided with enough, and so they work with what they have. If it gets dirty, and then they dump it somewhere, and then they continue to work without, nose masks, inhaling this, very hazardous dust into their system.
So given the challenges that you've just spoken about, what are some of the initiatives implemented to try and improve the health and safety of those quarry workers in Ghana?
So when we set out to do our research to see the challenges in the area, in the sector, it was our aim to use our findings to shape and change things. So after we finished with our research work, we went back to these particular stone quarries and met with management and showed them the findings that we had. Now, after showing them the findings, we were happy that they agreed with us that something must change. I mean, things must change for the better. And so we collaborated with them and we came out with safety manuals for the workers. And then we had the opportunity to train the workers on safety, occupational safety and health, and how they can manage themselves in the quarry and how they should take their safety issues very seriously. And this was fantastic. We went back to the quarries unannounced just to see what is happening. And we were amazed to see the workers now wearing personal protective equipment, because of our work. You understand? And so I believe that more research must be done in the industry, not only on silica dust. There are diverse ways in the wood industry, where they cut the wood and the wood dust, people are working without protective wears, and it's personal protective equipment. I mean, it's terrible. So there's a lot more work to be done. But HESAG Africa is a small NGO founded by me because I had a vision. And I can see that workers in Ghana, their fundamental human right, which is to go to work in a safe, healthy environment, go back home the way they went, was being infringed. You understand? And so that is why we decided to do this, to bring change, to shape the issues of safety and health in my home country, Ghana.
Dzifa, what does attending World Congress mean to you?
This Congress has been an amazing one, absolutely. Every Congress comes with something new, and you meet new people, connect with new people, learn new things, and improve yourself professionally, and then go back home to improve the situation in your country. And I've been glad that I'm be part of this one as a fellow, having learned from a lot of big guys in the industry, learning from what they have been doing all these years, and picking these very important pieces to go back home and affect things positively in terms of occupational safety and health for my people.
Dzifa, it's been an absolute pleasure and an honour talking with you today about your experiences and knowledge in OSH. And for our viewers, I encourage you to make the most of your delegate pass for the World Congress event platform, where you can access film sessions, symposia, and exclusive online content. Thank you so much for watching.